Bismillahirrahmanirrahim. Assalamu alaikum. I will be discussing waterborne diseases today. Water is life, but this is not always true. In situation of floods where there is water everywhere and this water is not potable, not safe for drinking. The same situation when the water get polluted and contaminated, there is diarrhea and dehydration leading to death, especially in children. You can see in this picture there's water pollution caused by industrial waste, effluents from the all kind of factories and the industries, as well as the hospital waste. The liquid waste is usually deposited. It's usually drained into the rivers or water bodies. And the biological life, including humans, animals, and birds, they are all at stake. So in this picture, you can see the water shortage, scarcity of water, leading to even contaminated, polluted water is not available for drinking. You can see just one tap with one pipe. They are filling all these utensils, and these are bottles. They are not hygienically, you can say, they are not fit for putting water for human consumption. So this is life. What is going on in low middle income countries and in poor resource constrained settings where there is no urbanization is there, but peri-urban slums and urban slums, they are exceeding the carrying capacity of that city. So in this picture, you can see these are the tests that are usually performed. The pH of water, total alkalinity, total hardness, total chlorine content, nitrite, heavy metal pre-check, and E. coli bacteria checking for fecal contamination. So these are the basic common tests that are usually run on drinking water. So, looking into the picture of 2025 about water quality, EPI, Environmental Performance Index, that shows the water quality in Pakistan. You can see it's here and it's in green zone. It's around 30. So the highest the level of index is, it shows that the water is safe and potable. There is access to better quality water, and that because this index is about the water quality, specifically water quality, not access. So you can see in Pakistan we have around 30. Actual index number is 25. So Pakistan is far behind the standard. Okay, so in 2024, the statistics tells us that 27% of the world's population lacks access to safe, managed drinking water. This translates to 4.4 billion people without safe water services. By 2025, 1.8 billion people will face absolute water scarcity. So that is terrible. Water scarcity is another big public health problem that is emerging, and unsafe water supply is one of the current problem that we are already facing. But scarcity will lead to no water availability. Globally, agriculture accounts for 70% of freshwater withdrawals. That is a huge amount. Industry uses 20%, while domestic use comprises 12%. This high consumption raises concerns about sustainable water management and food security. So we need to think about it. We are using fresh water for all these activities. Uh, As while there are other ways of managing water, managing the used domestic water for irrigation purposes, using it washing cars or washing the animals, bathing the animals. So in Pakistan is at risk of becoming the 15th most water-stressed country in the world by 2025 due to the growing impact of climate change. So We are 15th now, water stressed country. This water stress can lead to water scarcity in the coming years. What is sustainable development? Here comes the role of sustainable development, and it means that the current generation uses the resources in such a way that they you in such a proper way that they do not compromise the resources for the future generation. They make it sustainable. The resources like electricity, water, agriculture, the food production, everything, every such kind of resource must be used in a justifiable, in a balanced way, not exceeding the capacity of ecosystem. So if we are depleting our resources, it means we are depleting resources for the future generation. And if we make sensible use of resources, that is called sustainable development. Now, classification of water-related diseases. In water-related diseases, we have water-borne diseases, which are due to the microorganisms in the water. We have water-wash diseases, like washing with the water, the trachoma spreads, and if someone is using the same water, and then the trachoma can spread. Scabies, skin and eye infections, and we have water-related insect vector diseases. These are because of the vector breeding in fresh water or stagnant water, like malaria for the Anopheles mosquito that breed in uh, the stagnant water, while the dengue mosquito and yellow fever, that is the Aedes aegypti mosquito, that breed in fresh water collections. Okay, so water-based diseases include schistosomiasis and guinea worm disease or dracunculiasis. Okay, so in this slide you can see the bacterial, viral, and parasitic microbes. Bacterial include the diseases cholera and typhoid. Cholera caused by Vibrio cholerae, and typhoid is Salmonella typhi. Hepatitis A, which is orally transmitted norovirus, and hepatitis A is fecal-oral. Hepatitis E is also fecal-oral, while B, C, and D, they are parenteral route transmission. Parasitic includes amoebiasis and giardiasis, and amoeba histolytica, and amoeba histolytica is the causative agent, while the giardia lamblia is the agent for giardiasis. If you look at the global prevalence, 2 billion people use contaminated drinking water, and cholera causes up to 143,000 deaths annually, while typhoid fever affects 9 to 12 million cases annually worldwide. And in incidence rates by region, high incidence in sub-Saharan Africa, South Asia, Latin America. In Pakistan, hepatitis A is endemic. 50 to 60% of children infected by A by the age of 10. Diarrheal diseases remain leading cause of mortality in children under 5. So these reports are from GBD 2019 and WHO 2023. Sustainable Development Goal 3.3 states that to end the epidemics of AIDS, tuberculosis, malaria, and neglected tropical diseases, and combat hepatitis, waterborne diseases, and other communicable diseases by 2030. So, waterborne diseases, combating waterborne diseases is an important goal. That is the third goal, part of the third goal 3.3 of sustainable SDGs, and we have to achieve them by 2030. We have 5 years left for that. And here you can see these are the 2019 data about WASH. 1.4 million deaths have been prevented with safe WASH in 2019, and 74 million dailies could have been prevented with WASH in 2019. Attributable fraction, 69% of all diarrhea deaths in 2019 were attributed to unsafe wash services. WASH stands for WA is for water, S for sanitation, and H for hygiene. Diarrhea deaths, more than 1 million died from diarrhea due to unsafe wash in 2019. And acute respiratory infection deaths, 356,000 died from acute respiratory infections due to unsafe hand hygiene practices in 2019. That is something which can be prevented. And wash is a very good strategy that is used by in Pakistan as well and in multiple countries to control the waterborne diseases and acute respiratory infections as well. In Pakistan, for wash deaths for both sexes, 84,000. These are wash preventable deaths. How does inadequate wash affect children? You can see this diagram by UNICEF, and it shows how if there is open defecation and the feces they are not properly flushed or not properly covered, like you can use cat scratch method while going for open defecation, and there is access to flies, and from here, from feces, this contamination will occur into the fluid, water contamination, groundwater and underground water gets contaminated, and the fields get contaminated, and there's flies take the microbes from here, and the fingers get contaminated. So you can replace this with latrines, constructed latrines, and if there is a flush system, that's good, but at least the flies should not access, and their proper hand hygiene should be used. And if you see a hair from fluids, it directly affects the children and the families. And here you can apply the water treatment. You can boil the water. From fields, when you take proper washing of the vegetables is important. That can again prevent the contamination, transmission to polluted water, polluted vegetable, transmission to the family. And flies, again, you can apply the barriers. So we can apply the barriers in all modes of transmission. In fingers, proper hand hygiene is the solution. So this is a very easy way of explaining the barriers, the chain of transmission, and the barriers which we can apply. This is called the F diagram, breaking the fecal transmission route, and it covers the waterborne infections as well. If you can see the same diagram in a more better way, in which you can see we apply sanitation barriers over here between feces and these 4F, and then we can ensure clean water supply for fluids, and for hygiene, again, water is used for hygiene, and it is applied for finger flies and fields or floors, and between food and these 3F, from food and the future victim, again, hygiene, hand hygiene, food hygiene, utensil hygiene, everything, these type of hygienes will act as a barrier, and for the for getting the contamination or pollution. So for prevention and control, we can go for safe drinking water by using chlorination, filtration, boiling, or we can use filtration and then we chlorinate the water. Sanitation improvement through constructed latrines and sewage system, hygiene promotion by hand washing and water handling, safe water handling. Vaccination, we have typhoid and cholera vaccines available, and in clear cases of flood, there is a combined cholera typhoid vaccines available as well. You should have the concept of underground water. We have the water table is usually it's between two impervious layers. And what is a pervious layer? Pervious layer is a porous layer, and impervious layer is a layer, stony layer, or you can say the rocks. So if after the first pervious layer, there is first impervious layer, and after first impervious, there is second pervious layer, and then there is second impervious layer. So shallow wells, they are usually on the first impervious layer, because the water flows on the impervious layers, and there are cracks and crevices through which the water again it is diffused, it is transported to the low second impervious layer, and then trickle down in onto the second impervious layer. So in that way, we have two options. Either we go for shallow well on the first impervious layer or go for deep well on the second impervious layer. Cone of filtration of a well is very important. When you in rural areas, we usually have well, and in those well, that well, there is a cone of filtration, inverted cone, in which you can actually you can come to know that from where the contaminant is contaminating the well water. There are different methods to assess, to identify the contamination point. If there is a cesspool, you can add a bacteria into it or a dye into it, and there are different methods, and so we can discuss in subsequent videos. And so here comes the different methods of water purification. Again, boiling, chlorination, and filtration we already discussed. Chlorine tablets are available for at domestic level purification, or if you are moving somewhere, you're going visiting some area. And sedimentation is another process. If you are utilizing some river water or the water is very much polluted, you can recommend using the sedimentation technique, and then decantation, or removing the water layer slowly. In that way, you're not disturbing the sediment. And decantation, and after that you can boil the water, then add chlorination, or boiling or chlorination. You can opt for any one method. After decantation, it is preferred to filter the water and then apply chlorination or boiling. You can see in this picture, this is raw water or the river water. You add coagulant to it. Then this first phase is called coagulation. Second phase is called flocculation. Then there is sedimentation. You make the water rest over there for some days so that there is sedimentation. And then filtration, either slow sand filters or rapid sand filters. And then there is the option, or there is the step of disinfection. You treat the water for and make it potable, safe for drinking purposes. This is a little project that was submitted by that. This was an award-winning project on showing how multiple gravel, sandstones, and gravel is used to filter the water. And in this way, this wastewater can be made safe and potable. And this is a model of school children. This was presented by school children, and in this way, you can educate your students and your young generation about how they can convert the wastewater into safe potable water. This the another way when you are working with flood water. In that case, you don't have a boiling facility easily available. Then you can use alum to disinfect the water, and you first of all you can use a muslin cloth to filter the impurities. And after filtering that water, you can disinfect by using alum. And if boiling possible and in the flood affected area, then you can boil it as well. Otherwise, you can consume after adding alum. Community-based interventions. Traditionally, we have the WASH program, water sanitation hygiene campaign, school-based hygiene education, local water communities, managing filtration unit. So we can see RO plants in different localities. And the now new community-based innovations like participatory water monitoring, use of mobile apps for reporting contamination, for example, M water. And point of use filtration. At the point of use, you place solar filters or ceramic filters, and they're distributed to household or to a small area where 2 3 households can use that filter. Community led total sanitation, social mobilization to end open defecation. That is, still there are areas where open defecation is quite common. Behavioral nudges, visual cues in homes, schools to promote hand washing, and promoting correct technique of hand washing is very important. And this behavior change can be inculcated if we start from schools. So when you look at the challenges and opportunities, we have infrastructure gaps, we have financial challenges, we have behavioral and cultural resistance. But the opportunity is that we can integrate it with AI and uh, introduce remote sensing for water quality tracking. And we all, the globally, we celebrate World Water Day on 22nd March. So we conclude that the waterborne diseases are preventable with integrated public health approaches. Community participation is the key to sustainability, and the need for innovation and policy support for universal WASH coverage is needed. And together we can improve the water quality in Pakistan and world over. Thank you. These are the resource references which I used to prepare these slides. Thank you.